So here we are at 30 Devonshire Street, which is an outpatients section of the Princess Grace Hospital. And it's conveniently located just off Harley Street, between Marylebone Street and Harley Street.
But back and neck pain is such a common problem that it needs to be treated as part of a team, and part of that team involves everything from nursing staff, physiotherapists, osteopaths, chiropractors, all the way up to surgeons, but often the communication can break down, which is why we have our multidisciplinary team meetings, or MDTs. It's a really important way of communicating. People, specialists who look after our patients as part of the team, can bring their problems to us. We can discuss them in a roundtable sort of discussion.
So here at 30 Devonshire Street, which is conveniently just off Harley Street, where I'm based, we met each other through the fabulous team that they have here at 30 Devonshire Street, where they actually do look for a specialist to work with, so that each stage of your treatment plan is looked at and each stage reinforces the next. So what I find really great about working with your team here, Colin, is that the ease of referral and the fact that you have a fantastic team working here. So if I need any investigations, any results, not only is it immediately put together for my patients as well, on the day if I need any tests, sort of MRI, you've got your MRI scanner here on site, that can be arranged. And then not only that, but we also, with the team meetings, we can look at the results together and work out a treatment package that's bespoke for your needs. So Colin, how did you find the specialist that you want to work with here?
Okay, I think teamwork is the key word. What you want is you want to have a group of people who you trust, who you know how they work and you can refer to safely. What you don't want is you don't want referring your patients to somebody who you don't know what's going to happen, a bit of a wild card. And likewise, when we see patients, so I get a patient from a general practitioner, and I want to know that they're going to somebody who I can respect the way they work and is going to do the best for the patients. And if they're having difficulty, we'll bring them back and we can discuss it. So what we've done is, through trial and error, we have a whole group of therapists, people we work with, and we get the feel of how they work. So we meet you, we come back, see how you work, we ask patients how well you work, and it all gets that bigger feel. So we're building like a pyramid. There are people within the system to give us what our patients need, and hopefully we give you what you need from us.
Exactly, and it is also about making it easy for patients as well, and they, all the busy lives. I think it's one of the things I've got a lot of feedback from my patients is not only the care of the specialists here, but also the ease with booking appointments, booking up follow-up appointments here. It's, from my side, it's what makes 30 Devonshire Street unique. And as soon as patients know that that's where they're coming, not only is it the ease of coming location-wise, it's about the actual specialist, what they have to offer, because there's no two specialists alike. And I think the more you know who you are working with and the more information you have about their treatment plan, the way they worked, their background, their interests, it only makes that journey better for your patient ultimately.
Correct. One of the things we like to lead with all of our spines, if somebody's in pain, they don't want to wait 2 weeks for an appointment. They want it then and there. They want to know what's wrong with them. So what we do is we'll see a patient, we'll often be able to get an MRI scan directly, straight away, see them and discuss it. It helps you, it helps us, and it really, really helps the patient.